Hello everybody, Dr. Crose here with Capitis Medical and Aesthetics. Today I would like to talk about an issue in the medical industry amongst other corporate industries that has gotten out of control. I feel that this is something that is slowly taking advantage of physicians and other working professionals by industry and corporations. I'm not picking on corporations. I think they do a lot of wonderful things actually. But one of the things that I would like to point out is the non-compete clause that is in most contracts for physicians. This has been in other industries, and when I worked in biotechnology, they had one in there as well. Now, theirs was a little different and true to the more classic idea of the non-compete clause, which was originally created by corporations to avoid trade secrets being given to their competitors. Now, that's the original reason for these non-compete clauses. The issue with these is that it handcuffs physicians and other licensed professionals from basically doing what they want with their license and working for the community. Now, in my opinion, physicians, nurses, other medical professionals are actually an asset to communities and to the people. We take oaths to help people regardless of their ability to pay, regardless of what's going on in their life, and basically it's almost altruistic. Now, I'll give a talk on that at another time on my opinion on that, but I do feel that physicians and nurses should be allowed to work wherever they want as long as it doesn't interfere with their duties. Both Kaiser and Sutter, as well as Dignity Health, all of these industries and corporations have these clauses. I feel that they're detrimental to the industry. There's no trade secrets in medicine, guys. We all get trained the same. We all use evidence-based medicine, and we're all doing the best we can to help people. That's our goal. And yet these people control us. We work our tail off to get to where we are, thinking that it'll free us from the labors and I guess you can say restraints of corporations and industry, but in reality, medicine has been corporatized, and we are just another number, another automaton in the line of work for them. And unfortunately, we're not working for ourselves anymore. We are working for corporations. And I think physicians need to think about this, especially the younger ones that are coming up in this industry. We have the power to change this industry and mold it how we want to, but we need to take it by the reins and start doing that and demanding changes. When you go work for somebody and they say, oh, by the way, there's a non-compete in our contract and you have to get permission to work anywhere else using your medical knowledge or credentials. What they're basically saying is, we own you and we're not going to let you do anything without our approval, and unfortunately they never give you approval to do these type of things, and it's ridiculous. I mean, seriously, we work, a lot of us, 12 years or more of training between med school, residency, fellowships, and beyond, and now the industry's saying you can't work for someone else. It's like, whoa, wait a minute, I just want to go help some people over here. You think by me working for your competitor that I'm actually going against you, but it's not. And that's the problem with these industries, is everyone is their competitor. Anyone who you could possibly see, even a little mom and pop private practice, is their competitor. They want it all, and that's the problem here, is medicine's not about that. It's not about one ruling them all. It's not like Game of Thrones or Lord of the Rings or anything like that. We are all working to help our community and people, and it's really quite disturbing when you start looking at the legalities of this. Now, in California, it's a right-to-work state, and we technically can not obey that, But because of the arbitration clauses in those contracts, they have the right to fire you and let you go because it's a private company. But there's no financial repercussions for a breach of contract with that, except obviously losing your job. But so other states it may be different. Now this is kind of ridiculous in my opinion, because we are working professionals and we should have the choice of how and where we can use our degree and our training. As a matter of fact, you can't even do volunteer work without their approval. You can't go to some free clinic and take blood pressure and give injections or clinical advice without them saying you can do that. And I mean, this is a little absurd. Now, I have had this problem, and that's actually one of the reasons I stepped down from being a member at Sutter, is because they want, first of all, you have to buy into the group, which most groups do, but they also take away that right of you to do what you want to do. I now have a private practice, and I do per diem work in the hospital, which I love. I dearly love working in the hospital and helping people, but I also love doing my own thing and with my own creativity and my medical degree. I should be allowed to do that, but they're saying no, you can't. And this goes for all of you people and all of you doctors out there. Think about this. When you go to work for somebody, they want it all. They don't want to share. And this is a problem in the industry, and it's actually, in my opinion, a little bit antitrust, because we're supposed to be a pro-competition, pro-capitalism type of country, but no. There's all these little clauses in there that are quite contrary to that concept. So this is just my 2 cents on this. I can go on for days. This is already a long enough video. But anyway, I hope everyone's doing well out there. Once again, I am Dr. Joshua Crose, centered in Roseville, California. I hope you're all doing well. Take care.